experts. That many people, all of us are sitting over here, which medicine is effective in which type of disease. This is level 4. Then comes level 3B, some cohort studies. It means some group of medicine. One of us can say that in my clinic, I am attending 400 patients of rheumatic fever. So what he is doing that with a classical method. In one method he has developed, that he is going to give one streptococcin, like doctor has told us in the morning, and then he'll give one psoriasis and then britacarb for arthritis, some arthritis medicine, and he has managed 400 cases and he's following that. So if we have such type of evidences, this is known as level 3B. Then comes studies with multiple cohort. Today he has given this lecture, someone in Kanpur gets motivated, he also starts doing the same thing. And after 2 years they meet together, they say, I am also doing the same thing, you are also doing the same thing. One person is sitting in Kerala is also doing the same thing. His person is sitting in different parts of the world is also doing the same thing. And somewhere their method is same, that they are using streptomycin, streptococcin, with psoriasis, with whatever. So if we have that kind of evaluation, with this type of 4 and 3 is that biased factor. Factor is that you might be very much biased. That I feel this should be the way, this is my method, this is thing. So it is a bias. And in this bias, what you want to see, you see that only. And what you don't want to see, you don't see. So the next is, do some randomized control trial. Okay, you give one person to this medicine, let the other person take peridura. Let the other person take whatever conventional medicine is there. Or let the other person let us not give anything to that person. And this is how you manage few cases. Then it comes level 2B. That I have conducted one controlled experiment. And even in that experiment there is some effect. So then we have level 4 2B. Then comes level 2A, multiple controlled randomized experiment. Some person is doing similar experiment here, some person is doing in different parts of the, and their observations are same. Then comes level 2A. Most important, which is now known as evidence-based medicine, is level 1. That is meta-analysis and or systematic review. Now, in 2005, we were all shocked by the Lancet report. That was level 1 analysis of homeopathy, wherein the findings, although later on that report was also came out to be very, very heavily biased, but their objective was the same. That what they did, they said, whatever experiment over a period of ever since homeopathy was discovered, whatever level 2A type of experiment we have, let us review all those experiments. In how many cases homeopathy had shown positive effect, in how many cases homeopathy had shown negative effect. Now, many of us are teaching in a college, many of us are लेवल 4 वाला कर सकते हो, 3 वाला कर सकते हो, 2 वाला कर सकते हो या 1 वाला कर सकते हो. क्या कर सकते हो? कैसे करेंगे? लेवल 1 वाला तब हम कर सकते हैं जब बड़े सारे लोग, जितने 184 मेडिकल कॉलेजेस हैं, सब जगह बढ़िया मजे से तगड़ी रिसर्च हो रही है, और केरला से भी वही आवाज आ रही है, कानपुर से भी आ रही है, और दिल्ली से भी आ रही है, और हम देखते हैं कि लो जी, ये रहे हमारे 125 ट्रायल जो एक पब्लिश्ड है, और सबके अंदर होम्योपैथी का पॉजिटिव इफेक्ट है. तो आप कैसे कहते हो ये प्लेसिबो थेरेपी है? ऐसा तो हो नहीं रहा. हो क्या रहा कि ज्यादातर लोग अपने अपने घर में, अपने अपने क्लिनिक में, अपने अपने इंस्टीट्यूशन में जितनी जितनी समझ है उतनी उतनी समझ से कुछ ना कुछ कर रहे हैं. ठीक, जो कुछ ना कुछ कर रहे हैं, कुछ ना कुछ गलत या सही भी अपने स्टूडेंट्स को पढ़ा रहे हैं, वो इंटर्न अपने क्लिनिक पे जा रहे हैं, जो थोड़ा बहुत समझा, थोड़ा अपना लगाया, उसको अपनी जगह पे लगा रहे हैं, और यही सर्कल पिछले 30-40 साल से हिंदुस्तान में चल रहा है। तो ज्यादातर जो हमारे पास जो बातें हैं वो कहानियां हैं कि मैंने ये ठीक कर दिया, मैंने वो ठीक कर दिया, और वो सिर्फ लेवल 4 में आती हैं ना तो वो लेवल 2 में आती हैं, ना वो लेवल 1 में आती हैं। ज्यादातर वो जो स्टोरीज हैं, एनेक्डोटल एक्सपेरिमेंट्स हैं, लेवल 2 में भी तब आती हैं जब हम उनको किसी अच्छी जगह पे पब्लिश करा दें। आज के